Psychosocial risks. In this video, I want to break it down into a few simple parts. Chapter 1. What are psychosocial risks? Chapter 2. Cause and effect. Chapter 3. Risks and risk factors. Chapter 4. The silent risk. Chapter 5. How I assess psychosocial risks. And Chapter 6. From awareness to action. So let's start with Chapter 1. Chapter 1. What are psychosocial risks? In a workplace context, psychosocial risks are work-related risks that can affect a worker's psychological or physical health because of the way work is organized, managed, communicated, or experienced socially. In simple terms, these are work situations that can create psychological strain, emotional pressure, stress, conflict, burnout, or other harms to health. Yes, it can sound complex, I know, but by the end of this video, you should have a clearer understanding of what psychosocial risks are, where they can come from, and how to start addressing them in a practical way. Chapter 2. Cause and effect. The source can come from a number of different areas. It can come from coworkers. It can come from managers. It can come from clients, patients, suppliers, students, or members of the public. And it can also come from organizational factors such as workload, unclear expectations, lack of support, poor communication, low recognition, limited autonomy, or unfair decision making. The impact is not always the same for every person, but the employer still needs to take the risk seriously. These situations can affect a person's psychological health and, in some cases, their physical health as well. They can contribute to mental fatigue, chronic stress, burnout, conflict, disengagement, time away from work, and in some cases, a CNESST claim. Chapter 3. Risks and risk factors. One important distinction is the difference between a psychosocial risk and a psychosocial risk factor. A risk is a situation or exposure that can harm a worker's health. A risk factor is a condition that can increase, worsen, or maintain that risk. The main psychosocial risk factors generally include higher unbalanced workload, low recognition at work, low decision-making autonomy, low support from colleagues or managers, and deficient organizational justice. In addition to these risk factors, CNESST identifies specific psychosocial risks that employers need to take seriously. These can include workplace violence, psychological or sexual harassment, domestic or family violence that can affect the workplace, violence of a sexual nature, and exposure to a potentially traumatic event. For example, client aggression may be a workplace violence risk, but understaffing, lack of training, weak manager support, or unclear procedures may be risk factors that make the violence more likely or harder to manage. Number 4, the silent risk. I call it the silent risk because unlike many physical hazards, psychosocial risks and risk factors are often less visible. If a floor is wet, you may see it. If a machine has no guard, you may see it. If a worker is lifting something dangerously, you may see it. But when someone is overwhelmed, unsupported, treated unfairly, exposed to repeated incivility, or slowly burning out, it is not always obvious. And many workers do not speak up right away. Some stay silent because they do not want to complain. Some are afraid of the consequences. Some think nothing will change. And some may not even have the words to explain what is happening. That is why employers should not wait for a formal complaint before paying attention. No complaint does not always mean no risk. Chapter 5. How I assess psychosocial risks. To understand whether psychosocial risk or risk factors are present in a workplace, you need a structured way to gather information from workers. That does not mean guessing, and it does not mean assuming that everyone is fine because no one has complained. In my process, I use a short, anonymous electronic survey that workers can complete in about 5 minutes. The purpose is to identify what is happening across the workplace in a simple, structured, and confidential way. At the start of the survey, workers select their department. That is important because it allows us to see patterns. One department may be doing well. Another department may need adjustments. And another may need more serious attention. Without that department level view, the employer may only see an average result, and averages can hide problems. The survey is not the whole assessment by itself. It is a starting point. The results can be combined with other information such as observations, discussions with workers, incident reports, complaints, absenteeism patterns, turnover, workload changes, and the prevention measures already in place. The goal is to understand real work situations, not just individual opinions. Chapter 6, From Awareness to Action. Once the survey is complete, the next step is to read the data and address the needs accordingly. The goal is to identify which psychosocial risks or risk factors may be present, where they appear to be strongest, and what should be prioritized first. By doing this, the employer takes a practical next step towards identifying, correcting, and controlling psychosocial risks in the workplace. It also helps move the conversation away from assumptions and towards evidence. Awareness is the first step, but awareness alone is not enough. Once the risks are identified, they need to be addressed through concrete measures. That can include improving communication, clarifying roles, adjusting workload, strengthening manager support, improving recognition, reviewing fairness in decision making, improving reporting procedures, training managers and workers, or putting better prevention systems in place. And after the measures are put in place, the employer still needs to control the risks. That means following up and checking on whether the measures are working and making sure that the improvements remain in place over time. For more information or to get started, feel free to reach out to me by email or book a 15-minute discovery call. Think you're ready for the next step? Book your assessment today. Thank you.